One of the most difficult decisions you will ever have to make is deciding to euthanize your dog or cat. Just how do you know that the time is right? Of course, we don't want to make the decision too early, but far worse would be to leave our pets suffering too long. Delaying any decision for our benefit, and that's having our beloved pets in our lives for longer, rather than it being in their best interest. It is a fact of life that unfortunately our beloved pets very rarely pass away peacefully in their sleep without having been suffering from a serious illness for some time before that. This means that as owners we are likely to be put in the difficult position of deciding to euthanize or put to sleep our dog or cat. Our pet's quality of life is paramount, and the moment this starts to slip, we need to strongly consider what is best for our individual pet. It can be very difficult to know when the right time is, and ultimately every animal is different. There are no definitive, definite, clear-cut rules. There are, however, a number of questions that we can consider to help give us a better idea of our pet's quality of life, and so decide if they are suffering and they're continuing to suffer or not. Are they in pain? Is your dog or cat in any pain? Are they on pain-killing medication? And if so, how well is this controlling the pain? Being in constant pain is a terrible situation to be in. It may well be that currently your pet is pretty comfortable with whatever medications and whatever management strategies that you have in place, but we must be mindful of the fact that any chronic pain condition, such as arthritis, they only tend to get worse with time, and so we need to be aware that their pain levels will change over time. It may be that additional treatment is available, but if reasonable pain is a constant feature with no realistic potential for improvement, then we must consider if it is fair to put our pets through this. So next is your pet eating? For many people, if their dog or cat is eating, then we consider that they must be reasonably happy and comfortable. This is just not always the case though, and so I'd caution against using your pet's appetite as the only judge of whether your pet is okay or not. That being said, you can consider if they're eating well or not, and instead, do they need actually encouragement? What about hand feeding? Or are you actually having to syringe food into your pet's mouth, or even through a feeding tube? Next comes, is your pet drinking and well hydrated? So coupled with eating well, often an animal felt to be drinking well is felt to be a good thing. In fact, the opposite can be true, as many illnesses can actually cause a real big increase in the amount your pets drink. And these include kidney failure, diabetes, hormone abnormalities, and many more. Instead, we should consider if they're able to remain hydrated or not. If they are becoming dehydrated either despite drinking lots or because they have stopped drinking, then it is imperative that we act quickly. Dehydration is likely present if your pet's gums are dry or if their skin stays standing in a tent after being pulled away from the body. This intervention might be to start other treatment strategies, or it might be to decide that the time has come to say goodbye. Next, is your pet able to keep clean and toilet appropriately? Is your pet incontinent? This in itself might not be too much of an issue if you're able to deal with the mess produced. If they're not able to be kept clean though, or if they end up lying in their waste for long periods, they are likely to be suffering. They may develop skin sores or matting. They're more likely to develop urinary infections and other complications as well. So, does your pet seem happy? Now, this question is obviously much more subjective, and you know your pet the best. Do you think that they're happy? Are they interested in what's going on around them? Do they still look forward to mealtime or going for a walk? Do they enjoy interacting with the family and other pets in the house? Or instead, do they seem stressed? Are they bored, scared, or lonely? Are they even aggressive? Our pets are capable of feeling all of these emotions, and they should not be ignored. It is very difficult, if not impossible, for your vet to know if your pet is feeling any of these emotions. We only see them for a really small snapshot, so go with your gut feeling here. What mood is your pet in the majority of the time? So next is your pet mobile? Can they stand up by themselves? How well do they move? Can they still run, or does every step just look like a real struggle? Do they regularly stumble or fall over? If they need help, are you able to provide this for them? as often as it's actually needed. It can be very difficult to help a large breed dog who is unable to get up by themselves or can't climb the front steps to get back into the house. Pain clearly might be the factor here and an issue that we've already discussed, but there are other conditions that can also cause mobility problems and that are not in themselves inherently painful. So next is, are there any other concerns? Do you have any other concerns about your dog or cat? Are they breathing easily? Have they started having seizures or vomiting on a regular basis? And next is, are there more good days or are there more bad days? Answering all of these questions gives us a snapshot as to how our pets are feeling and what their quality of life is at that particular moment. And clearly this will change over time. So some days they might be better and some days they might be worse. If the number of bad days outweighs the number of good days, then euthanasia may very well be the best decision for your pet and the best decision that you can make for them. So next is, what disease or health concerns does your pet have? This is also an important consideration. If your pet has a long-standing disease that is never going to be cured, such as kidney failure or arthritis, and they're slowly getting worse despite all the treatment options available to them being implemented to the best of our abilities, then we need to be realistic. Your pet is only going to continue to get worse. I know that many pet owners I've spoken to have serious regrets about holding on to one of their pets in the past for too long, and when they look back, they wish they had made the decision to end their suffering sooner than they actually did. If your pet is suffering from a condition that can potentially be cured, or the situation greatly improved, such as a serious infection or a traumatic event, then it's often much more acceptable to monitor and continue to push for that improvement, even if in the short time your pet's quality of life is currently compromised. If things are looking bleak though, again, euthanasia is an option. So there are a lot of questions here which just highlights how difficult it can be to know if the time is right to euthanize your cat or dog. Your vet will clearly try and help guide you and help you through this difficult decision-making process, but ultimately it is up to you to make that final call. Now, if all of the above has only made you more confused, then I have three simple statements of my beliefs that might just help you. The first is that it's better to euthanize a week too early than a day too late. The second is that if you're thinking that it might be time to say goodbye, then very often it is. There is clearly something significant going on that is making you seriously think about euthanasia. And then the third is that euthanasia may be the last final act of kindness you can show a sick pet by ending their suffering. So you've made the decision, and what happens next? Well, clearly this can be discussed, and it should be discussed with your veterinarian ahead of time. It may be possible for them to visit your pet at home so that they don't have the stress of a car journey or dealing with a busy clinic. It might be that you can schedule an appointment for a quieter time of day. Can you pay the day before or after so that you don't have to think about this at the time when you'll clearly be very stressed and upset? Also, you'll need to think about whether you want to take your pet home with you afterwards, or maybe you feel that cremation is something that you'd like for your pet and you'd like their ashes returned to you. It's far better to try and make these decisions ahead of time rather than rush into anything at the time of euthanasia. The procedure itself is generally very quick. It involves injecting a large overdose of an old anaesthetic agent into the vein in the leg. If your pet is nervous or very uncomfortable, then they may be given a sedative injection first just to help them relax. They may also first have a catheter placed into their vein to ensure that the injection itself is felt as little as possible. If you're anxious about the procedure, again, ask your veterinarian that will perform the euthanasia about the process ahead of time. The whole procedure will also likely be explained to you at the time before it's carried out. Now, once given the euthanasia drug, it generally acts very quickly, with your pet first falling into a deep sleep before the heart stops beating. Once the heart has stopped beating and your pet has passed away, a number of things can then happen. They may take some big gasps, they may lose control of their bowels, and they may stretch or twitch a little bit as well. And this is just the body letting go. It's not a sign that your pet is still alive, and it doesn't in any way indicate that they're in any form of distress. Now lastly, many people feel guilt after making the decision to euthanize their companion. You may feel anger at having been unable to help them get better. And in fact, we grieve for our pets in the same way that we deal with the loss of a family member or friend. And actually, it's been shown to be worse than many close family members. When we go through denial, through anger, bargaining, depression, and finally acceptance. You should never feel ashamed or embarrassed about grieving for their loss. Our pets, after all, they're an integral part of our family. If you're struggling with the loss of your dog or cat, then reach out to your vet team, reach out to friends, family, or seek professional help. The extra support can really be vital for helping us deal with the loss of a beloved family member. So I hope this answers some of the questions that you might have had about when the right time to euthanize your pet is. Remember that quality of life of your pet should guide all of our decisions about any treatment or otherwise. Do what you feel is best for them and you won't go wrong. Take care.